Fatigue, digestive issues, and urinary frequency are just some of the symptoms that can result from having low potassium levels. Potassium can be found in high concentrations in foods that are made entirely of plants. If your blood potassium level is lower than 3.5 millimeters per liter, you have low potassium, also known as hypokalemia in the field of medicine. Sodium-potassium, a vital mineral, experts perform a wide variety of functions throughout the body. To give only a few examples, it can assist in the control of muscular contractions, the maintenance of healthy neuron activity, and the regulation of fluid balance. It is believed that the majority of adults do not meet their daily demands. Notwithstanding the significance of this fact, the Western diet, which prioritizes processed foods over whole plant foods that are high in potassium and include fruits, vegetables, beans, and nuts, is likely to blame for this phenomenon. The Western diet prioritizes processed foods over foods that are high in potassium. However, hypokalemia is only infrequently brought on by a lack of potassium in the diet alone. It may be brought on by a variety of circumstances, such as fluid loss, malnutrition, use of certain drugs, creating medical problems such as kidney failure. Keep watching to find out more information about potassium insufficiency, including the symptoms that come along with it. But before we move further, kindly subscribe to this channel for more amazing videos. Talk to a medical practitioner if you believe your potassium levels may be dangerously low, and you are getting treatment for renal illness that includes the use of certain drugs, such as diuretics. They will look over your blood tests and make any necessary adjustments to your medications or diet. Seek emergency medical assistance if you have been experiencing persistent fluid loss or if you have abused any drugs in any way. The following is a list of 8 indications and symptoms that indicate a potassium deficit. Number 8. Weakness and a feeling of exhaustion. There are a few reasons why weakness and exhaustion are typically the first indicators when someone is potassium deficient. To begin, potassium plays a role in the regulation of muscle contractions. When there is a shortage of potassium in the blood, your muscular contractions become less forceful. Second, a lack of this mineral might interfere with how your body processes nutrition, which can lead to feelings of exhaustion. For instance, there is evidence to suggest that a deficit can interfere with the generation of insulin. Because of this, your blood sugar levels may become elevated, and you may have less glucose available for your cells to use as a source of energy. Number 7. Weakness in the muscles and cramping. A muscle cramp is a sudden contraction of the muscle that is not under conscious control. They can develop when there is not enough potassium in the blood and can be rather painful. Potassium plays an important role in the transmission of impulses from the brain to skeletal muscle, which in turn serves to trigger contractions. By exiting the muscle cells, it also contributes to the termination of the contractions. If there is not enough potassium in your blood, your brain will not be able to transmit these messages as well. This leads to contractions that last for a longer period, which is thought to contribute to muscle cramps. In cases of mild or moderate hypokalemia, cramping is quite uncommon. But in cases of severe hypokalemia, where the potassium level is less than 2.5 millimeters per liter, cramping is a possibility. Rhabdomyolysis can be brought on in extremely unusual circumstances by acute hypokalemia. This potentially life-threatening medical disorder is characterized by the breakdown of muscle tissue, which results in the release of a protein into the bloodstream that is harmful and can cause organ damage. Even while significant muscle weakness almost always results from severe hypokalemia, it can manifest suddenly even in cases of mild or moderate hypokalemia. In most cases, severe hypokalemia is the cause of major muscle weakness. Number 6. Disorders of the digestive system. Even though digestive issues might have several different causes, one of those factors could be severe hypokalemia. Potassium assists in the transmission of nerve impulses from the brain to the muscles of the digestive tract, which are known as smooth muscle. These signals provoke muscle contractions, which in turn assist the digestive system in churning and propelling food in the proper direction for digestion. If your potassium levels are low, the contractions in your digestive system may become less strong, which will hinder the transportation of food through your digestive system. This could lead to digestive issues, such as bloating and constipation in some people. Number 5. Unusual rhythm of the heartbeat. Additionally, potassium is an essential component in the upkeep of proper contractions of the heart muscle. The reason for this is that the movement of potassium into and out of heart cells plays a role in the regulation of your heartbeat. This flow can be disrupted when there is insufficient potassium in the blood, which can lead to an abnormal cardiac rhythm condition known as arrhythmia. Arrhythmias of the heart are another symptom that may point to a more serious heart disease. Seek emergency medical treatment if you observe any abnormal changes occurring in your heart rate. Number 4. Difficulties in taking breaths. Breathing problems are one of the symptoms that might arise from a severe potassium deficit. To enable the lungs to take in and release air, breathing relies on the coordination of several muscles, most notably the diaphragm. If your blood potassium levels are dangerously low, your lungs may be unable to expand and contract normally, which can lead to a feeling of being very short of breath. A severe lack of potassium can even prevent the lungs from functioning, which can ultimately be fatal. According to the findings of one study, those with hypokalemia or hyperkalemia, which are abnormally low or high blood potassium levels, respectively, had a considerably increased risk of respiratory failure and the requirement of a ventilator when hospitalized compared with individuals with potassium levels that were considered healthy. Number 3. Tingling and numbness in the extremities. Insistent tingling and numbness are symptoms that can be experienced by persons who are potassium deficient as well as by those who have high potassium levels, a condition known as hyperkalemia. The hands, arms, legs, and feet are the most common sites affected by this condition, which is known as paresthesia. Potassium plays a crucial role in maintaining normal nerve function. The symptoms of tingling and numbness might be brought on by low blood levels, which can damage nerve signals. Persistent tingling and numbness, on the other hand, could be an indicator of a more serious underlying problem. While it is not harmful to experience these symptoms on occasion, for example, if your foot falls asleep due to lack of activity or sitting in an awkward position, it could be a sign of an underlying condition if it occurs frequently. If you encounter this, you should get in touch with a medical professional as soon as possible. Number 2. Urinary frequency or polyuria. Polyuria is a condition in which you urinate significantly more frequently than normal. Your kidneys are in charge of maintaining the correct levels of fluid and electrolytes in your body, as well as eliminating any waste products through the production of urine. Your kidneys' ability to concentrate urine and maintain electrolyte balance in the blood may be affected if your potassium levels are too low, which may cause you to urinate more frequently. You can also experience something called polydipsia, which refers to an increase in thirst. A possible cause of decreased potassium levels is urinating an excessive amount. If you suddenly detect a change in the frequency of your urination, you must consult with a healthcare practitioner as soon as possible. Number 1. Hypertension or high blood pressure. To keep your blood pressure at a healthy level, it is essential to have an electrolyte balance that is just right. You might already be aware that taking in an excessive amount of salt might cause some people's blood pressure to rise. However, very few individuals are aware that consuming an inadequate amount of potassium through one's diet might have the same impact. Your kidneys can excrete more salt through urine when potassium is present in the body. When there is an insufficient amount of potassium in the blood, the kidneys will reabsorb sodium back into the bloodstream. This might eventually cause high blood pressure. This happens most frequently when there is insufficient potassium in the diet, and more precisely when there is hypokalemia. Therefore, ensuring that your food contains an adequate amount of potassium could be a strategy for some people to keep their blood pressure at a healthy level. If you have high blood pressure, you should discuss monitoring and treatment options with a qualified medical expert as soon as possible. This brings us to the end of this video. We hope that you enjoyed it. Kindly give your comments in the section below. And don't forget to subscribe to Wellness Wisdom for more interesting and informative videos.